Good day. I'm Justin Gernot, and I want to welcome all of you to the HIMSS Digital Influencer discussion on the acceleration of digital health amid COVID-19 and beyond. Coming to you live from home offices and guest rooms and basements all over the United States. First and foremost, I hope you and your loved ones and your colleagues, and particularly your patients, are all well and safe. So I'm with HealthBox. We're an innovation services firm that joined HIMSS in 2018. Since that time, we've engaged with health systems, large insurers, and market suppliers on innovation programs and strategy, digital strategy, commercialization, sourcing, and investing. You may know HealthBox from our early days as a digital health accelerator and our more recent investment management role with Geeta, or you may have heard of us from the HealthBox Foundry, an internal accelerator we co-developed with Intermountain Healthcare starting back in 2015. Since the pandemic started, we've been talking with innovation and analytics leaders at health systems across the country about how we at HIMSS can help support the rapid changes we've all been forced to either make or accelerate. In April of this year, HIMSS launched the Digital Health Indicator, a rapid diagnostic tool that assesses digital health maturity for health systems. And what we've all found out so far in 2020 is that the changes we need are the manifestation of what's in that HIMSS Digital Health Indicator. So I hope that all the providers out there who are watching will take a look at that and reach out to HIMSS for additional guidance. Today, I have the great fortune to speak with all of the 2020 HIMSS Digital Influencers, a group that's been chosen for not only the roles they hold in our industry, but also the voices they have and the way that they advocate to ensure that we, as an entire industry, continue to provide the very best in health and healthcare to everyone. So let's get started with some introductions. Again, I'm Justin Gernot. I'm the Vice President of the HealthBox. I'll start out to my top left here. Geeta, please introduce yourself.
Justin, thanks so much for having us all together. I'm Dr. Geeta Nayyar. I'm the Executive Medical Director for Salesforce. I'm also a rheumatologist and a mom, so I'll be giving you my perspective on our topics today from that lens.
Great. Good to see you. How about you, Chrissa?
Hi, everyone. Thanks again, Justin. See you. I'm Chrissa McFarlane, the founder and CEO of Patientory. We're a digital healthcare company that's innovated with technology such as blockchain, and we're based out of Atlanta, Georgia.
Awesome. Lygeia?
Hi, I'm Lygeia Ricciardi. I'm the Chief Transformation Officer at Continuum, which is a digital health platform. And I have spent all of my career, including at Continuum, advocating for patient engagement and empowerment within the context of digital health. I'm usually located in Washington, D.C., but today I'm calling in from a lake in Wisconsin, where I'm very fortunate to be for a short while.
That's awesome. How about you, Jen?
Hey everyone, I'm Jen Horonjeff, founder and CEO of Savvy Cooperative, which is a patient-owned co-op that helps to connect companies and innovators with patients to do user experience or market research. Because I myself am a patient, I've grown up with 5 different autoimmune conditions, most notably juvenile idiopathic arthritis, also had a brain tumor removed 7 years ago, so really focused on the patient perspective. Also have an academic background and worked with the FDA for some time.
Great to have you with us, Jen. Stacy?
Hi everyone, I'm Stacy Hurt. I am based in Pittsburgh, PA. Personally, I am a stage 4 colorectal cancer survivor, as well as a proud mom of 2 sons, one of whom has a very rare chromosome disorder and suffers with multiple disabilities and special needs. Professionally, I am an independent patient experience consultant who works with health systems and industry to improve patient experience and amplify the patient voice. Thank you.
Great. How about you, Mike?
Yeah, Mike Rucker. I'm the Chief Digital Officer of Active Wellness. We're part of an ambulatory care unit for Providence. We provide upstream services through fitness delivery and wellness services and various installations like corporate campuses, medical centers, and multi-tenant properties.
Jamey.
Hi, Jamey Edwards, CEO and co-founder of Cloudbreak Health. We are a unified telemedicine and healthcare disparity solutions business that's in 1,200 plus hospitals across the country, doing over 85,000 encounters a month on our platform. And I really cut my teeth on the provider side of healthcare, so hopefully going to represent providers today and how we can improve their experience and therefore have them take better care of patients using great technology at their fingertips.
Matt?
Hi, I'm Matt Fisher. I'm a corporate and regulatory healthcare lawyer at the law firm of Myrick O'Connell. I'm based in central Massachusetts. I tend to work with all different types of companies throughout the healthcare industry. So, that can be digital health companies that include remote patient monitoring, telehealth, consulting, all forms of SaaS type services. I also work with pretty much every type of care delivery organization, whether it's solo or up to multi-hundred physician groups, community hospitals, skilled nursing, and everything else that might be out there. So it ends up being a pretty wide swath of the industry. In terms of the perspective that I'm going to be bringing, it's trying to take a view of all the different issues that have arisen and apply either a legal or a regulatory lens, but also trying to think about ways in which different challenges can be overcome, which usually means trying to find ways to collaborate and work together and get all the information that you might need.
All right, and Rasu.
Hi, everyone. Rasu Shrestha, I'm the Chief Strategy Officer for Atrium Health. Atrium's a large not-for-profit health system. We're headquartered out of Charlotte in North Carolina and have a footprint that spans across the Southeast, the North, South Carolina, and in Georgia. And I must say, I love the passion, but also the diversity of this group. So really excited about our conversation today.
Yeah, I am as well, Rasu. This is a lot of fun and an important conversation with some really good people. So I want to start by reflecting on what you've all learned as through the panel discussions and some of the ongoing conversations that you've had over these last few months as a HIMSS influencer. And Lygeia, can we start with you? What have you learned, and maybe what would be your call to action for folks out there?
Sure. A couple thoughts. One is about managing COVID generally. And I think that as we look at how the pandemic has influenced and impacted other countries around the world, we've really seen that although it is, of course, it's a disease, it's a biological threat, there are many opportunities to manage it through our behavior. And I think that that's important, and it also ties into something that I think we've learned because of COVID about how we can better push opportunities to patients to be engaged in their own health on a daily basis. So very big picture, there are a lot of difficult and frightening things that we need to face in the healthcare landscape now, including COVID, as well as a whole range of other diseases and conditions. But the experience that we've had with COVID has, in a number of ways, reinforced the idea that, for me, that patients can play a really good role in managing and improving and impacting their own health, as well as the health of their communities, if they have the right tools. That's not to say that we've always done it well, but I think that some of the other countries in particular are demonstrating that those who were really ravaged by COVID early on have managed through various ways of social distancing, wearing masks, and other kinds of behaviors to manage the impact of the disease. Similarly, I think if people can use particularly some digital health modalities to manage their everyday lives better, we can better manage things like chronic disease and other conditions too. So very big picture, it's been tough, but a really positive thing is that we do have the power in our hands as individuals and as a society to impact things for the better, particularly if we learn from others, learn from data, and use the tools that are available to us.
Lygeia, that's great. And you pointed out something really important. Experience often leads to wisdom, right? It's that best teacher. And unfortunately, the countries that had sort of the worst time with prior pandemics, with SARS and swine flu and Ebola, are often the ones that are doing the best right now. Without regard to what their health system looks like, and without regard to even what their government looks like. Just having that prior experience has allowed them to leverage that experience into what's turning out to be a better situation for them this time. So I certainly share your hope that we're all learning, and that we're all really doing our best to empower patients and consumers to make those right choices for themselves, and to take their part of personal responsibility. Right, we're seeing a lot of folks who realize that, gosh, the money doesn't matter. What I do every day though does. And I think we've heard pieces and parts of that through all the panel conversations we've had already. How about Stacy? What did you learn as you've gone through this, and what would you share as a call to action for others out there?
Well, it was funny when COVID started and everything went into play about social distancing and extraordinary measures to protect ourselves. You know, I sat back in the life of being a stage 4 cancer survivor and the caregiver to an immunosuppressed child. And I basically thought, welcome to my world. I've been here all along. You know, now you get to see, the rest of the world gets to see a typical day in the Hurt family life. That all through treatment, you know, I was washing hands, removing shoes, not being able to hug people, having people enter my house literally with a mask on, taking, you know, like I said, extraordinary precautions to protect, you know, my health going through cancer treatment, as well as my son's health being immunosuppressed. So, you know, this has been an extraordinarily difficult time, but I think that it's taught important lessons in empathy and really putting yourself in somebody else's shoes and understanding what it's like to be a patient. And first, I never saw what came from my son's illness. I never saw it coming. I had a healthy pregnancy. I never knew in 1,000 years I would have a child that couldn't walk, talk, or do anything for himself. And I never saw my situation coming. I was the healthiest person that I knew. I ran the day before I was diagnosed and was a non-smoker, a fit individual, a healthy eater, and I was struck down by stage 4 cancer. So I think what COVID taught us was that we're all one day away from a devastating health crisis that renders us helpless as patients. And so I would just, my call to action to everyone would be maximize your healthy days. Take advantage of health screenings and educating yourself on really living the best life that you can, because you just never know what's around the corner. And in those healthy days, what you can maximize, now what we've seen, innovations from COVID, are all of these breakthroughs in healthcare technology, such as telemedicine, telehealth, remote patient monitoring. And we see all of these innovations that can now empower us as patients and caregivers to, as Lygeia said, you know, really empower ourselves at, you know, in this role to take charge of our own health. And so that, again, coming from somebody who is an ongoing patient, an ongoing caregiver, please do not take your health for granted, and please do everything that you can to take charge of your health now and be preventive and proactive the best you can.
Well, Stacy, thank you so much for that. That's a really powerful message, and lots to. I'm sure many of you here are thinking about how you can make the most of every day. Any responses to what Stacy shared there? Anyone who's maybe doing something a little bit differently in the midst of, you know, all the tough things we have to do with work, and I know many of us are parents and have taken on school and parenting over these last few months. Anything you're doing differently to make the most of these days and really be appreciative?
Oh my gosh, Justin, we're doing everything differently, but I would completely agree with Stacy, who I always admire and appreciate. You know, I think we're doing everything differently. I think both for my patients as well as a mom, as well as for my organization, right? Mm-hmm. So number one, all the things we've been talking about in healthcare are actually happening, right? I've always told patients, the emergency room is not where you find me, right? Like, let's stay out of the emergency room. What are we going to do to make sure that we stay out of the emergency room and actually get the right care at the right time? Mm-hmm. And yeah, you know, you need to take some responsibility, right? To eat well, take care of yourself. Now in the age of COVID, it's about wearing a mask, socially distancing. So there are also going to be things that I can do for you as a doc and things that I can't do. As a mom, you know, it's getting back to basics. It's going outside, going running, going biking, doing things with our family, cooking at home. So there's a lot of good that's come out of it. I think where the industry needs to think is that in the past, we always talked about patient engagement as a nice to have, right? It's nice to have patient engagement, nice to have digital platforms, virtual health, but I think COVID has now accelerated that. And what we're appreciating at Salesforce is everyone is saying, how do I do it? And not just in a reactionary way, but now very thoughtfully and strategically going into next year. Again, it's not about the new normal, it's about the new exceptional. And how are we making sure that hospital systems are meeting patients where they need to and where they're at, and that patients are responsible to say, I should really know my doctor, whether virtually or in person, but I really should have a doctor, to Stacy's point. And, you know, this could happen to me. And if it does, how do I be preventative about it? How do I be thoughtful about it and less reactionary?
Right. It's in a lot of ways, it's driving home old maybe is the wrong word, but it's driving home time-tested lessons, right? These are not new things. What we've done so far, aside from the research on the vaccine, which is going to be new and novel, everything else is just the second half of innovation, right? Innovation is invention adopted, or at least that's our favorite definition for that. So the inventions have been there, right? Masks, hand washing, telemedicine, taking care of yourself, right? These are all things that have been around for quite some time. And in Stacy's case, she's used or has been treated by folks who use those in her home. So just you're right, Gia, there are a lot of things that are the unfortunate, that came along because of unfortunate circumstances, but hopefully stay around. I hope people are really good at hand hygiene a few years from now when we're no longer in a pandemic. I hope we're all taking time to make meals with our kids and do those things, and maybe not quite back to the full tilt crazy schedules we had before.
I will tell you that my daughter has perfected the happy birthday song to a point that on our birthdays, I'm hoping we no longer have to sing happy birthday and we come up with something else, because the kids have taken it home. The younger kids are definitely, their behaviors are being set, right? And that's not necessarily a bad thing, to your point.
Justin, to your point too, I think, it's a bit provocative, so we don't have to, stay on point, but, comorbid conditions, have a high correlation to mortality with this particular situation in the pandemic. So I think it will be interesting to see, in history, we've seen, things like cardiac events, at the end of one level, be highly motivated. It will be interesting at a macro level, if it's explained well, that, a lot of the folks that are having the toughest time with this, particular virus are the ones that, might have had lifestyle disease conditions that could have been mitigated, to see if that has an impact as we move forward.
That's a really good point, Mike. I for as many people as are, are complaining about having gained weight during the pandemic, it also makes you wonder how many, how many more had the opposite, impact and decided like, hey, I've got 2 or 3 things that put me at risk. Anyhow, even before the pandemic, what do I need to do moving forward? So Mike, since you spoke up, I'll ask you next. What were your lessons learned, and what's your call to action?
I think for me, it's just really been interesting. Someone that's sort of been an entrepreneur, within my company. We have an idea lab where we try and help folks bring, digital health products to market. And, sort of pre-COVID, this interesting Silicon Valley, lean principles, not meshing well with the way, hospitals bring digital health to market, right? A lot of times you'd see lean teams not bring in stakeholders from the hospital, and often have that innovation, sort of stall because it wasn't, working within the philosophy of how things move in healthcare. But that's pretty much been, broken into pieces. And so, telehealth obviously being one of the biggest, we're, by some accounts seeing, 4,000% increase in telehealth in certain practices. That's just wild, right? So, the fact that we can now use this as a model to challenge production paradigms, or, development paradigms rather, is interesting. I think with that said, though, the huge caveat is making sure that we continue to have empathy for the end patient. Before COVID, with our partners, we were looking at various at-home care with IoT. And the thing that I learned in that process is the amount of onboarding that needs to be done. especially with the aging well population. But once you do that, you're sort of off to the races, and you see really high outcomes. But
you're seeing high incomes. How do you do that right now? I'd love to know.
Yeah, my bad. And that wasn't a Freudian slip. But the problem is what we're seeing now, this is anecdotal, so it's not data driven, but anecdotally, you are hearing stories where, folks are successfully using telemedicine, but, the devices that folks have to use at home to be able to be a partner in that care, there's some failure. In fact, I have my own anecdote where I was using an old blood pressure cuff, and I showed like 160/140, which wasn't my real, blood pressure, but it's because the device that I had at home was old. So, things are going to change. It's clear that both physicians and patients like telemedicine. If we're using that as the hypothetical for, many things that are going to accelerate as a product of COVID. So what can we learn from that? And then at the same time, how can we continue, if not more, apply more empathy for the end user? Because we're now putting a lot bigger burden on them, as they become, co-create this medical experience with the practitioner. And so my call to action would be, where are developmental models that we can build specific for healthcare? One of the big barriers with lean principles that always, kind of hampered that methodology for medicine was fail fast, right? You can't really fail fast with medicine because if you fail, it, potentially puts lives at risk. But that doesn't necessarily mean we can't pull the best from each one of these programs and create developmental models that are specific for digital health innovation that will work for both sides. And so, we've validated that we can do things quickly. And if we add some of the components that we've learned along the way, like deep empathy for the end user and involving medical stakeholders early on in the development so that you get the team right, I think, it will bode well in the future.
That's great. Yeah, Mike, we've definitely proven that for the providers out there, those big organizations, those elephants can dance, and they can move, and they can dance pretty quickly. So Matt, what'd you think as you went through all the webinars and other interactions with the influencers? What'd you learn, and what would your call to action be?
So I think there's a lot to learn and a lot to be able to take away from the perspectives that everyone has brought, and also everything that has come up throughout the course of the pandemic. But to me, the kind of the biggest takeaway is the fact that after all these years of wanting to drive change and wanting to see the implementation of new and different ways of doing things in healthcare, it was actually proven out that the industry can be extremely nimble and extremely quick-footed. Overnight, you went from kind of what would have been phrased as business as normal to having to completely change the model of how care was delivered. And the industry, and when I say the industry, I'm thinking really across the board within the industry, whether you're talking about hospitals, physician practices, and a lot of other types of care settings, we're able to figure out ways to meaningfully connect with patients and help with a continuum of care, as opposed to just having people completely drop off of the system. So that was really encouraging. Obviously there's still bumps in the road that will need to be resolved because you can't expect anything to be rolled out perfectly. But I think this experience really helped to hopefully overcome some of the fears that these new kind of digital or electronic based tools were going to cause more harm than good, because it's you've seen a lot of people get used to it, and a lot of people actually appreciate and want to see the changes, especially the ability to access care remotely, made permanent and become an ongoing piece of the care delivery system.
Great. And what would your call to action be to the folks out there who might be listening?
Yeah, I think the biggest call to action would be, collaborate and coordinate. Those sound like pretty basic tools to be, or considerations to be coming from, but too often it seems that people are trying to do it their own way, or trying to get in front of someone else within the industry to have some type of a competitive advantage, or just other unique position. But if we all come back to the basic premise for healthcare at the end of the day, which is, we want to be caring for individuals and we want to be having the patient at the center, I think that really should drive those concepts of collaboration and coordination, because everyone should be working hand in hand. And, I think there's plenty of opportunity for everyone to be able to succeed.
I loved Matt's focus on kind of coordination and collaboration. The fact of the matter is healthcare is incredibly siloed. And it's siloed because of our laws and regulations. It's siloed because of privacy. It's siloed within healthcare systems where one department doesn't talk to the other about what technology decision they're making, and between healthcare systems as well. And so I eventually would love to see better coordination, better collaboration. We always talk about at CloudBreak how we should be surrounding a patient with their care team. And the technology really allows us to do that. Imagine a very complex patient from a population health management standpoint who has multiple chronic conditions. Well, we could theoretically now assemble the best possible care team for them on a national basis to support them locally. You could have their internist from the Mayo Clinic, their cardiologist from NYU Langone, et cetera, et cetera, et cetera, a dietitian from Cedars-Sinai, right, who specializes in exactly their comorbidities. And that, to me, is where things get really, really exciting. But it's going to take collaboration. It's going to take coordination. And when Matt said that, it really resonated with me.
I've heard several CIOs sort of quoting each other saying that all of our projects that we think are technology projects are 85% people and 10% process and 5% technology. And we've certainly proven that over and over again, right? No one cares really much what the technology is. It's more like, can you get the people aligned appropriately? Can you get them trained? Can you get them to the right place at the right time with the right level of information? And in the instance or the example you just shared, getting those right specialists lined up is so critical. So it reminds me of the HIMSS Digital Health Indicator, which just came out a few months ago. The base foundation level of digital health delivery is workforce and governance. It's all people. It's all, do you have the right privacy in place? Do you have the right portability of data? Are you able to make decisions quickly? Are you able to do things in a coordinated fashion? And do you fundamentally have the right people in the right places to do the right things? So it's in some ways it's a confirmation of what so many of us have lived and have known. In other ways, it just exposes how much more work there is to do. It's got nothing to do with bits and bytes, which end up being the easy part right now.
Yeah, so Justin, to that point, Stacy Hurt's story has always just really resonated with me when she was talking about trying to get her patient record from one place to another, so that she could get the proper consults that she needed. And one doctor's like, "Hey, I'll fax it," and another one's like, "Hey, I need to print this out. I need to burn a CD-ROM for you." And you're sitting there like, oh my God, like we don't have the technology to actually email the file from one place to the next, or to put it in a Dropbox, or to share it. And those are the types of things that aren't technology issues. They are infrastructure, structural, regulatory, payment, reimbursement, those types of issues, and fundamentally just trying to change some of our human behavior.
Yeah, well put, and great to tie it back to Stacy's example. I totally agree. What did you learn as you went through the programming with the influencers, and what would your thoughts be for folks out there who might be listening?
Yeah, well, what a crazy year it's been, right? I think one of the things I learned overall via, COVID and the involvement in the HIMSS program is that technology really isn't our issue in the healthcare system in terms of advancement, progress, and innovation. It's really a cultural and structural issue that presents all of the obstacles. At the end of the day, sharing a patient file really isn't a technically hard thing, and I don't think there are any amazing technological advances that were made during COVID that leapt things forward. There wasn't a new AI, XYZ that was launched, or a new machine learning, or a new type of video, or anything. We just had this external catalyst that forced us to innovate and work together in a way that we, before didn't have an impetus to do. And we saw silos and barriers being broken down from a regulatory standpoint, and it really led to a catalyzing of the technology that we all use in healthcare. And to me, the biggest impact is this concept now of the digital front door in our healthcare system. And the fact that we can be digital first in a system that previously valued that in-person visit more than the virtual visit. And I think we saw the rise of of telemedicine as an everyday tool that's integrated into how physicians practice. And we saw it as a way to increase access, increase convenience for the patients. And patients built a lot of muscle memory in and around a lot of these technology tools that previously existed that were catalyzed again by COVID. So this digital front door to me is going to be really the future of healthcare. From a call to action standpoint, you know, I'm talking to health systems out there right now and saying, look, embrace digital health or watch your competitors do so at your peril. I think patients before could vote with their feet. That was a lot harder to do in a geographically centered bricks and mortar healthcare system. But now, with everyone carrying healthcare around in their pocket, I think we're going to see these patients voting with their fingers, and their expectation is going to be that they can access their doctor on their terms, you know, when they need to. And hopefully that's actually going to make physicians and providers' lives easier as well. You know, sometimes we talk about being patient-centric or we talk about being provider-centric. I think what we need is a more human-centric healthcare system that takes into account all of those different stakeholders. I also think that one of the things I learned that despite all this technology, healthcare is still local, and patients really want natural care escalation of their existing continuum of care. And while there's always going to be a place for episodic care, I think what we're going to see is eventually the existing care continuum is going to integrate these digital tools, and they're all simply going to become not telemedicine, but the new medicine.
Matt, what about you? Reactions to what Jamey shared?
Yeah, I mean, I think the point that Jamey made that, you know, we didn't see any groundbreaking technology. It was building off of stuff that was there is really important. But that I think that also kind of underscored the fact that the healthcare systems didn't necessarily have the right infrastructure in place or had modified their infrastructure in such a way that they couldn't quickly or effectively implement, you know, kind of a telehealth platform or other tools up, you know, up front. You know, one example that I had heard about was, you know, a physician practice wanted to roll out telehealth, but they had disabled the cameras on all the laptops that they had given to their physicians, and they couldn't figure out a way to re-enable them, so they had to like give them back their old laptops or force people to come in with their personal computers or personal iPads or tablets to be able to run it. So it's, you know, I think even though we're not dealing with new technology, it's, you know, getting everyone up to speed in terms of understanding, you know, what do we need to do to actually make what we have work effectively. And then to some degree, I think that probably goes to Jamey's point as well about, you know, the loosening of some of the regulatory requirements, at least while we're, you know, still in the course of the public health emergency, allowed, you know, arguably an easier time for this to happen. Although, you know, obviously with my lawyer hat on, I would say, you know, a lot of the barriers that people perceived didn't actually exist. They just created them because they didn't want to do something. You know, but even that being said, it's, you know, with the fear being removed, that allowed, you know, the pace to move forward pretty quickly. You know, so hopefully, you know, when the rule, you know, because we can't expect that all these rules are going to be waived or, you know, had a blind eye turn toward them forever. You know, hopefully as they come phasing back in, the organizations have had the time to be able to appropriately and effectively figure out how to use the technology that they have to support these advances. And then, you know, kind of the takeaway that Jamey provided of, you know, we should be thinking of telehealth not as telehealth, but just as part of what medicine is and what new medicine is. You know, I think that resonates with what I've heard from physicians and also, you know, articles and stories that you'll read where people had been resistant to using it previously, and now that they were, you know, kind of shoved into using it, realized, wait, this is actually a really effective means of interacting with patients, of being able to actually provide more care because you can, you know, you're not kind of wasting the time of having people come in, sit in the waiting room, and, you know, taking half a day. Now you can get things knocked out in an hour or less usually, and it makes it, you know, it really just meets people where they want to be. And I think, you know, that really applies on both sides, both to the care delivery team as well as the patient. So, you know, I am optimistic that we're already in the burgeoning phases of recognizing that this is how healthcare is going to be delivered, and it's, you know, kind of connected to that, it's also, I think the physicians have recognized that more could be done using these remote means of communication than had been contemplated. And it's recognizing that, yeah, it's not going to replace in-person care because there are obviously things that must be done in person, but being able to kind of appropriately triage the different pieces of the episode of care to the right place to have it delivered. As I said, I think it's going to make everyone happier, and I think it's going to allow care to become a lot more efficient. So, it's definitely, as Jamey said, it's a new paradigm for medicine, and I'm really hopeful that we will be in there really quickly.
Oh, I got to believe that genie is out of the bottle, and we're not putting it back. All right, so Chrissa, what have you learned these last few months, and what would you ask folks to do out there?
Yeah, absolutely, Justin. Basically, the past few months with the rise in the COVID pandemic has really shown us, on a macro level, just how, uncoordinated we are in terms of our usage and our maximization of technology. So, you mentioned earlier that innovation is, new technology adopted, and we've had telemedicine, patient remote monitoring, which was present in the industry in, decades or so, but really had low utilization until the pandemic occurred, where policies were laxed in order to actually start that usage. So that there, coupled with the really inefficiencies and inequities that exist today in our healthcare system, we definitely, saw that increase with underserved populations more or less having the least amount of care. We see it in the headlines with, African American populations being most at risk to, dying from the actual pandemic. So I think, with moving forward, the takeaway is, from a macro perspective, how are we, addressing these inequities with the usage of technologies, and what policies can come out of this. Long term, that would, start to create a more collaborative and cohesive healthcare ecosystem.
That's great. And what would be your call to action out there for individuals and organizations?
So that call to action would be more in terms of, policy generation, but also, I would say more or less a global health IT infrastructure. So we saw the World Health Organization, who was at the forefront of it. They had trouble gaining data from China, from other countries, but really starting to look at how countries are held accountable for their healthcare reporting, and of course, with that, being able to utilize technologies.
One thing that I'll add to that is, there's a stark realization that the walls between where healthcare has traditionally functioned, sort of the medicine element of this, and public health, which has really been quite separate from medicine, the walls between those two entities have really come down to your notion of the policy element, right? I think that is so important for us to realize that for us to really push for not just how do we better manage a pandemic, but also how do we really manage this element of health and care. Those two walls really do have to come down, and we do need to be a lot more cognizant of not just what happens within the walls of a hospital, but how the policy changes, how the incentives, how the innovations really affect also what goes on in the public health realm, because that's really where those habits perpetuate. That is really where behavior perpetuates. So those two entities really do have to be thought about and made actionable as one entity.
I would agree with that, Russ. I'd also just layer on that I think there's also a sense of community that's come together, right? Like the healthiness of a community. We're all now talking to our neighbors. Some of us didn't know our neighbors before. We're going biking. We're seeing other folks out there. I think there's a sense of that personal community, and then that public health from a community standpoint. Are there parks? Are there, you guys know I'm a tennis fan, are there tennis courts, right? This idea that we've got to move, and we've got to move together, and that it really takes a village, not just to raise kids, right, but to actually be a healthy community and a healthy society.
Yeah, that's a really good point. We've got this private health health system, and it's not even a health system so much, right? It's this very much federated, fractured way that we deliver healthcare, not necessarily health, that doesn't hold up so well during a public health emergency like we have right now. And I think your points are both really well taken. Who else? Who have I not heard from yet? Rasu, things you've learned the last couple months, and a call to action you would have for folks out there.
Well, one thing's clear, and we've talked about this quite a bit, but we should never let a good crisis go to waste, and that's one thing that we're really doubling down on here at Atrium Health. There's been a trifecta of punches that we've faced as not just an organization, but really as a society overall. First and foremost is the pandemic itself, right? And how a health system like us reacts to that pandemic and really lives up to the expectations of caring for the communities that we serve across the Southeast. But then there's also the economic ramifications, and that's the really sort of the second punch to the gut, not just for the health system, but for individuals as well across the societies that we're catering to. And then the third, and I want to call that out as well, is sort of the social inequities that this pandemic and the consequential economic ramifications have really highlighted, the disparities. And I think all three of those elements are actually quite related. And so when we think about the context of that in the framework of this VUCA environment that we're functioning in, the volatility, the uncertainty, the complexity, the ambiguity of the environment that we're functioning in on, what the pandemic has done for us is I think it's actually shown a light on all of the cracks and fault lines that we knew that we already had in healthcare. But it's also shining a light on the muscles that we knew that we had, or maybe muscles that we didn't know that we've had. So specifically in terms of the call to action, I'd say three things. One is tech is here to serve, right? So this call to action to serve, that's what healthcare has been about for the longest time. That's who I am about as a physician, as an entrepreneur, as an innovator. So let's make sure that we align our mission to our actions, and the outcomes will follow, right? So that's really important, the service notion. The second is let's close in on the gaps in care. I think the social inequities that the pandemic has really exposed, those fault lines that I mentioned earlier. I think it's really important to make sure that we close in on those gaps. We're leveraging, GIS capabilities to hotspot out various zip codes where, African American populations, Latino populations, where we've noticed that they were actually not getting the level of testing that they needed, and we're able to immediately deploy our mobile vans and deploy those resources, capabilities, and within a week, they were on par with the rest of the other zip codes in the communities that we're serving. So really closing on those gaps. And then thirdly, let's be a part of the reopening of the economy. I think that's really important, and we need to do this in a safe and intelligent manner. And I think if we do this right, healthcare, health tech, all coming together, we can spur the next wave of the economic resurgence. It's not science versus the economy, it's science so that we can have an economy. It's science so that we can win together versus the virus defeating us together. Because that'll happen if we don't let the science element really play out. So healthcare and health tech can do so much to really facilitate the reopening of the economy, right? So with technology that facilitates the next normal workspaces and workplaces and cultures, the capabilities to ensure more of a COVID-safe approach to how we handle the interactions, not just within a health system, but really in our communities. And then technology to enable things like syndromic surveillance so we can really open the aperture about what's happening, not just in our regions, in our communities, but globally, and then react to things in a much more agile, nimble way, coordinate supply chain and care coordination in a much more coordinated manner across the board. So let's be a part of that reopening of the economy, because I think that is really, really important.
Russell, that's fantastic. I love that. One of the things that we're appreciating is we have hospital systems coming to us with really creative partnerships and asking us how we can do exactly what you talked about, which is right now it's about reopening the schools, right? So we've had hospital systems get really innovative because of that focus on the mission to serve, and obviously the same for the schools. And so we're trying to come up with, what is the digital platform and digital strategy to help connect the hospital systems with the school systems, whether it's contact tracing, whether it's symptom checking, temperatures, and what do you do if a teacher or a student tests positive or has a fever, and how do we usher them through the healthcare system in a way that empowers the economy, to your point. So I'm appreciating that the community aspect and the innovation aspect isn't just about, we tend to think about it, as technology, but I think it's also getting innovative about creative partnerships in a way that extends beyond the health system and actually involves the whole community to ultimately serve us all being healthier. And of course, the economy goes hand in hand with that.
Yeah.
I agree. And just to add to that, I think from the partnership perspective, to make those partnerships and the work that we're doing with our patients, our communities sustainable, I think one of the things that we really need is more of a mind shift change. Because the mindset that we had going into this pandemic was, all right, let's just hunker down, let's do everything that we can, and soon enough, it'll be behind us. Soon enough, the surge will flatten out, right? Flatten the curve. It'll flatten out, and the virus, the pandemic, will be behind us. And the realization that we have right now is that we're actually in this for the long haul, and that's important for us to have in terms of a mind shift, because the way that we work, our business models, the very interactions with our patients, it's not that they will change; they're already changing, right? And that's going to be change for the long haul. So we need to really embrace that mindset to make sure that we get this right, and we're not really burnt out as a result of this hey, let's hunker down and let's make sure that we do everything around it, and then things will get back to normal, because this really is that next normal that we're talking about. We're living through it right now, and it's here to stay.
I'd like to say it's the new exceptional, right? And you're right, this is not going to be a Band-Aid. We can't put a Band-Aid on this and just it's going to take care of itself. It's going to heal. We've really got to come out of this understanding that it's a marathon, not a sprint. And not only that, I don't want to go back, right? I don't want to go backwards in healthcare. I want to go forwards. I think every one of us wants to go forwards. I mean, again, HIMSS is helping us to do that, right? So it's about what is the new exceptional healthcare, given all of the cracks that we've seen, and how do we never be unprepared for something like this again, right? And how do we actually come out of it even that much more resilient, and also with the consumer who has fundamentally changed their mindset about healthcare, right? There's now patient responsibility, people who are not going to the emergency room, a consumer who's adopted telehealth that we didn't think would, right? The Medicare population, we're seeing data that's saying, hey, you know what? I can tell you as a rheumatologist, my patients, I want to see them as well, but unless they need an injection, unless they need an intervention, we're doing it virtually, right? And for the first time, they're more comfortable doing that than they ever were. And again, in the pediatric population, very much with back to school opening, people are asking that, right? Customers are asking, how are we going to do this? So I'd like to think we're going to come out of this stronger and better, but we have a ways to go for sure.
Yeah, one key concept I want to reemphasize is that healthcare partnerships. So it's starting to, shift that mindset from healthcare being or just residing within, an institution and go into a hospital or a health system, to really looking at how we can think about healthcare outside of that box, with employer organizations, with community systems, and making healthcare not just going to the hospital, but something that is inherent to, everything we do on a daily basis. I just saw that Google, their employee workforce is not going to be back in the office until 2021. How can they as an organization start to think about running a company with a healthcare mindset? So it's looking at our economy, which is really financial focus, to now being more, how can we incorporate, markets and how we do business with a healthcare focused.
Yeah, you bet. Really, really good points all. I want to get some reactions and lessons learned and call to action from Jen. Jen, what's on your mind?
Well, I think, what my esteemed panelists here are talking about, especially talking about like the aspects of the fact that things are changing, about the sense of community and all these other lessons learned, coming back to the patients and thinking about what is their role in helping to design the future. And so that's what I, on a personal level, and what, we are seeing from a professional level is happening is, how do we make sure that the next generation of healthcare is something that works for patients? And I think that this is where we've seen there's been a lot of struggles with the siloed aspects of healthcare, that things don't work together. I, tell people openly that I am a non-compliant patient. Geeta, please don't scold me as a rheumatologist, but I am terrible at getting my labs done, because every time I do, and I just get a CBC, the insurance company will always bill it incorrectly with the lab. And so I get this enormous bill. It's a CBC, it should be a few dollars, but I know that it's going to take like 5 hours for me to call all the different people to be able to reconcile this. So I just say, my labs are pretty uneventful, so I'll deal with that next time. And I am very, very ingrained in this system, but I make those calculated choices because the system isn't working for me as a patient. So as we design the next generation, how do we include people like myself and other patients in that conversation so that we're getting that intel, so we know why they're not doing these things? That's why when I think about the sort of the marriage between sort of big data and sort of those other patient insights, is that big data can sort of flag these issues. It's a signal. It tells you that there's a problem, that something's wrong, but it doesn't explain why, and it doesn't tell you how to fix it. And that we have to actually go to patients and ask them these things. And of course, we really need to double down on making sure we're talking to diverse patients, and that we're not only solving problems for people we might talk to in San Francisco, Boston, and New York. How do we make sure that we're including people across the country with different backgrounds, with different needs? Because even so, someone like myself couldn't speak on behalf of somebody living in the middle of the country as a single mom, working multiple jobs under completely different contexts. So if we want to create more inclusive innovations or systems to make sure that those patients get the care that we need, which we obviously are seeing such health disparities, we need to include them in the conversation. So that's what I would really like to see, to make sure that we're not just throwing more tech at the problem. That is also not the answer. I see that a lot right now as people are redesigning clinical trials or how to continue to help patients maintain their care. Tech isn't always the solution, and not all tech is created equal. And so thinking about that even through the lens of telehealth, not everyone has a safe space to take those conversations, and not all of us have a pretty background. We, sometimes on these Zoom calls compare backgrounds, and sometimes people are living in places with many, many family members or other people in their home. They might be talking about stigmatized conditions. And so just thinking through all of these things that may prevent a patient to be compliant just because everything isn't set up in such a way that, is working for them. So I would like to challenge people to really think through, as you're creating these new innovations or reassessing the old ones, including patients in those conversations so that we can accelerate the development of more inclusive healthcare solutions.
Jen, I really appreciate you sharing that, and I'm always happy to talk offline, by the way, with all the things you have on your plate. So I'm always a resource to you. One of the things that I've also taken away from this whole pandemic is health literacy, right? So injecting not just the patient in the conversation, but just having a dialogue. And I think we've also seen the power of media. We've seen the power of all types of media on getting both good information as well as bad information out there. And I think just we've got to up our game on health literacy and what is basic healthcare knowledge that people should understand. I'm amazed that, it took a pandemic for people to understand how a virus works and spreads, whether it's COVID or not, right? So the basic understanding and educational levels and different socioeconomic status, cultural, we have to make that effort because it's the foundation that anything we do in healthcare is built on. And it's not about technology. It's not about money, throwing money at the problem. They're just some basic things we have to make sure we continue to communicate and work on as a strategy.
We've got 4 lightning round questions, then we'll get on to some additional comments. So the biggest change you've noticed occur in your team or your organization amid the COVID-19 pandemic? Lygeia, I'm going to call on you first.
I think there has been a heightened sense of intensity
Heightened sense of intensity.
there, but like, boom, we got to really work hard to make change now.
Got it. Chrissa?
Efficiency does not rely on physical location.
Very good. How about Mike?
It's out of context. It's like, but it takes all types. I think to provide a little bit of context and cheat, we have folks within our four walls that have physical conditions that can't wear masks, and we have employees that don't feel comfortable catering to those folks that aren't wearing masks. So for us, it takes all types, and we're still in the process of trying to figure out, how to all play nice together, and that's going to be a journey.
Yeah, great. Love it, and appreciate the context for sure. Geeta?
Good days and bad days. We're all a lot more understanding. We're just a lot more understanding. We're all struggling. We're in this together, but I would say we're struggling in this together, and there's an appreciation for what that means to each of us individually.
Yeah, totally agree with that. Rasu?
We're together finding our sense of purpose.
Awesome. Stacy?
Power to the patients.
Very good. Jamey?
The work has never been more important. So the biggest change that I've seen in our team is that the work's never been more meaningful and more important. COVID has really catalyzed us and accelerated our product roadmap in terms of really developing solutions that help to move the needle for our client partners. And so one of the things that comes to mind is telequarantine, being able to enable doctors who are in hospitals to not have to go into the room, to basically create a connected care room just using the devices they already have in hospital, and being able to wheel an iPad in and then stay outside the room and connect with the patient, and have the patient then be able to connect, with the provider from outside the room, and have the patient be able to call it to family members to reduce isolation. That telequarantine platform that we developed, and by the way, a 2 or 3 week period and then rolled out to hospitals nationwide, to me was a symbol of, the work's never being more important, the team really rallying and locking arms. And that was largely a result of, the catalyst of COVID.
That's great. Matt?
Many want to do the right thing. I think it's easy to fall into a trap that everyone's out there just to look out for themselves. But, kind of throughout the course of the pandemic, I think you've seen a lot of people step up and really try to advance the public good and, provide a benefit that can help a lot of people. I saw that with clients that I work with, of trying to either provide free access to tools or develop new tools to help others when it comes to care. And then it's, within my own firm, obviously we're not kind of squarely within healthcare, but it's trying to get as much information and guidance to folks out in the community as possible, so that way they could access things like the PPP loans or other programs that the government might have been rolling out, or just to really help kind of general operation of businesses, so that way you can keep as many people as possible protected and safe during the uncertain times.
Who has inspired you most during the pandemic, and whose leadership are you looking to as we recover? Could be the same person, could be two different people. I'm not calling on Lygeia first. I'm calling on Rasu.
Can I say Dr. Fauci?
Oh, I was just going to say that's so easy.
Yes, you can.
I've sent this tweet out as well, and I've seen it from Geeta too. But Dr. Fauci was the lead author for Harrison's, which is the internal medicine textbook, which was my go-to book during med school and beyond. And he's my go-to guy right now as well. I mean, this is science over politics. This is science over some of the irrational things that we're seeing out there. Mm-hmm. So Dr. Fauci, all the way.
Awesome.
I have to jump in. So I trained under Tony at Nayyar. He's a rheumatologist and infectious disease doc. I'm a rheumatologist, so I trained under Nayyar. So in DC, I trained at GW, and we do a solid 6 months at the NIH, and just mad respect for that man. Pre-pandemic, post-pandemic, during the pandemic, he's really lived it, and I think we couldn't look to a better leader, period, in science or otherwise.
Awesome. Thank you, Geeta. So again, during the pandemic, and who do you see leading us out of the pandemic? So you can mention two people if you want. How about Stacy?
I mean, I don't want to suck up here, but honestly, I am looking to this group that has been assembled today. I look to my fellow change makers and digital influencers. I have so much respect for all of you. I have learned from all of you through this pandemic, and I truly believe that this group that we're talking among today is going to lead us out of this pandemic and is going to reshape, reinvent, and re-innovate healthcare.
Awesome. Jen.
I would say who am I inspired by and who am I sort of looking to for leadership right now? I wouldn't say it's pandemic specific, but I am looking towards the Black community to help provide leadership and who is inspiring me every day.
Awesome. Mike?
I'm going to take an unorthodox approach and say my wife, because my life is overprescribed. You know, I'm part of this amazing group. You know, I'm writing a book and I'm the CDO of my company. And so every time, you know, there's an additional complication, like we just found out, you know, schools are going to be stay at home for even longer than we were told a couple of weeks ago. Just having a strong partner in my life to be able to navigate some of this stuff, because if it was up to me, I'd be freaking that out. And so, you know, having someone like that, you know, to be able to say, hey, it's going to be okay. And sort of, you know, there's a new thing every week, right, that we have to react to. So for me, it's more internal than external. And it's just neat to have a strong partnership where, you know, someone assures you that everything's going to be okay in the end.
That's great. Matt?
Physicians, and in particular my wife. And so, you know, I think a lot of physicians and other healthcare clinicians, you know, as you keep seeing, didn't go into the business of medicine or the practice of medicine with the intention of having to potentially risk their lives every day. And it's, you know, despite that, you didn't see people complaining. You saw people just going out and wanting to make sure they could do the right thing. And, you know, it's, you know, I said my wife in that part because my wife is a primary care physician. So it's, you know, she was going in right from this, you know, she never really got a break from going into the office. It was going in, you know, for a period of time doing telemedicine, or then, you know, as patients started to come back in, but it was always, you know, I'm going to figure out a way to make sure I'm protected and can get as much protective equipment as I can. But at the same time, it's patient care needs to continue and need to be there to help people out in their time of need.
Crazy. Jamey?
So I have two answers for this, Justin. My first answer is my 5-word answer, which is, you know, I'd like to thank Winston Churchill for the phrase, never waste a good crisis, because that has resonated with me throughout this whole COVID instance, is the opportunity to actually affect positive change in what is a chaotic environment. But when I think about who really inspired me, you know, essential workers. Essential workers can include those frontline healthcare heroes that we saw reporting for work every day. But I actually give a ton of credit to the other essential workers, whether it's grocery store workers or whoever it might be. They were running other essential businesses, didn't even necessarily have the healthcare understanding, but were showing up every day to make sure that the people that they served, you know, got what they needed, were able to go out and get food, you know, and those types of things. So I'm going to go with essential workers on that one.
Okay. And Lygeia?
I'm inspired by the community that I live in, and in particular, the frontline workers, the people who are not just in the healthcare professions, although that's incredibly important too, but they're at the supermarket or delivering food or picking up trash and just day in, day out dealing with risk and uncertainty and coming through. And in some ways, in a broader sense, I think that's who's going to lead us out too, not just the frontline workers, but the community. We don't want, or I don't want necessarily one amazing figure, although please bring more of them on, more Fauci's, please. Let's clone him. But like, it's the common everyday person working together that's going to have the sort of strength to not only manage this disease, but the forbearance to just get through it, muscle through it. and help
Yeah.
one another.
Yeah, I think, Lygeia, similar to you, I'm really inspired by all the parents, because we all, as parents, or as the positions we have within our families, within our group of friends, we all have an obligation to try and bring each other up, support each other, bring our kids up the right way, and teach them what it means to be a good person and a good citizen, and to be healthy. So yeah, I would love to see more Fauci's. I'd love to see more. I'd love to see like the role that Atul Gawande is going to play, because we need people with really good medical backgrounds who are fantastic communicators, who can maybe deliver that in some different ways that people will pick up and learn from, long after the pandemic is gone, hopefully. But yeah, I think we've all got an obligation to lead. How about you, Chrissa?
Yeah, so I've been inspired really during this time by John Lewis, and he passed recently, God bless his soul, but just looking at the legacy he left, the symbolism of coming from the civil rights movement to where we are today, and just how much further we as a nation, as a people, have to come together in unity, to really embrace the diversity and what the value that each individual brings as a collective.
We talked about this a little bit, but what impact have your influencer colleagues had on you through this whole experience? How about we start? Who looks confident and ready to speak? Geeta.
Always ready, Justin. Always ready for you. I would say that I've really appreciated this group to help me stay connected and really zone into passion and purpose through all of this, because it's very isolating, right? So to know that we're all still connected, and we're all even that much more aligned on our purpose in healthcare and in our own world and space.
Got it. How about Matt?
Inspiration and connection. Being able to connect with the other members of the digital influencer team, there are so many different learning opportunities, because we all come from very different backgrounds and very different perspectives. So it's really being able to hear those on a more consistent basis, and also I think a little bit more of a personal basis, because for the most part, I think a good chunk of us knew each other before this program, but this has given kind of a built-in way to have different calls and different ways to be able to communicate with each other, which I think has been really beneficial. And it was, I think right after the annual conference was canceled, and I think it was Jamey actually who kind of coordinated a call with all of us while the HIMSS staff was slammed trying to deal with the fallout from that. And the tenor was just how can we all band together and be able to continue to provide some content and some benefit and connection for everyone out in the community. So it's that feeling of connection is really what I've taken away from it, and why honestly I'd like to keep coming back to all the different programs that HIMSS operates.
That's great. Thank you, Matt. Jamey, same question.
I'm going to go with leadership and learning. You get on the phone with, the theme of the HIMSS program and digital influencer program this year was, be the change and changemakers. And man, if that wasn't a, forward thought-provoking theme that couldn't have been more relevant to the situation that we were all going through. It just created a lot more meaning and importance as the year went on. And you get on the phone with these people who are being the change and kind of living that mantra in their own various verticals, whether it was Stacy from the patient side, Matt from the legal side, Geeta, Lygeia. Like, I've just been so impressed with the quality of the insights, and it's made me, not only have I learned from every single other person who is on the program, because they have a lot of domain expertise that I don't, but just the general discussions about how to push healthcare forward were really inspiring and made me want to put more thought into what I was doing and integrate some of that thinking into what we were doing as a company and what I was personally doing in my own life. So I would definitely go with leadership and learning.
All right, so Chrissa.
Being a part of the influencer group, I've learned a lot from everyone's experience. I wrote a quote earlier where it's like, our stories are not for ourselves, it's for everyone. So, being able to see everyone's perspective where they come from in terms of the industry, has really helped to drive even what we do at Patientory and then with our company.
Awesome. Impact your influencer colleagues have had on you, Rasu.
They've infused a sense of humility.
Awesome. Mike?
Always surround yourself with people smarter than yourself.
Very good. Stacy?
Amplified the patient and caregiver voice.
All right. Lygeia?
This community has given me a sense of grounding and reality check. And I know I'm going over 5 words, but I want to say a lot of you, all of you really metaphorically and sometimes realistically in real life wear, like that cape of superhero, like amazing jobs by day, complicated existences by night and by weekend. And I think that watching you all navigate this and not just do it with grace, but also admit that it's hard, talk about like, this is how it's been difficult and I'm still swinging, has been really helpful because it's a reality check and it's okay to say, this is really tough. I'm fed up. I've had enough. And yet we're going to help each other get through it.
All right. Very good. Thank you. And Jen?
I would say it's this multi-stakeholder sort of group that I really appreciate. I think that that's how we're going to get farther faster, is when we actually surround ourselves with people with different vantage points.
Final question. What is the first thing you will do after COVID-19 is over?
Travel to a brewery.
Here, here. No explanation needed. Jamey, how about you?
What's the first thing I'm going to do when COVID? I am going to hug everybody, random strangers in the street. Right? I'm a guy who fills, his cup on being with other people, and being from an extrovert standpoint. And so not being able to like hug my friends and hug, distant family members or whatever it might be, like, I'm going to hug everybody.
That's great. Geeta?
I'm going to go see my mom. I miss my mom.
Awesome. Very good. Very good. Rasu, first thing you're going to do after the pandemic?
Finally going to take that trip to Spain to celebrate our 20th wedding anniversary.
Congrats. Mike?
Yeah, definitely take a trip, either go back to Atlantis in the Bahamas or go to Italy and see the Colosseum, some big bucket list item.
Very good. Lygeia?
Throw a party. Enjoy space with people I enjoy, as well as food and drinks and music.
Lygeia, I just invited myself. I'm coming. We're doing this.
Not do it on
or DC. We're all there. Jen?
I'm actually moving during the pandemic just to a new neighborhood. So I want to be able to actually go explore my new neighborhood and go check out new restaurants and coffee shops and all that fun stuff someday.
Very cool. Chrissa?
Get on a plane and go somewhere in Asia. So I'm thinking Thailand or something like that.
Very nice. And Stacy?
Yes. Celebrate my 50th and my 5-year remission the way that it should be celebrated. So I guess I'm going to Lygeia's party.
That's fantastic.
I've invited all of you to Lygeia's party. I'm inviting everyone for you, Lygeia.
My 50th and 5-year. Perfect. At least we have a theme.
Yes.
That's awesome. Well, I just want to close by thanking every one of you for everything you've done as part of this HIMSS Digital Influencer Group this year. You didn't quite know what you were applying for when you signed up, right? This has been an unexpected year in every way. I appreciate every little thing that you do at work, out of work. I thank you for the heart and the soul and the thought that you put into every interaction that you've had here, the way you've really brought your best self and brought the best out of each other. I really hope and frankly expect that what we've done here is going to inspire as well as educate so many folks who have the chance to interact with this. I want to thank Michael Gaspar for being the man behind the scenes, who put it all together, who not only organized this group, but supported it in ways big and small. So thank you all. It's been fantastic. It's been a pleasure. I look forward to Lygeia's party because I'm overdue to celebrate a birthday or two that got cut off in my family. I hope you'll all. I hope to see you all virtually and especially in person someday soon. Have a great day, everyone, and thank you.